And good morning. Welcome back to We Got Options with the Doctor and Son. We're so happy that you joined us today. Today, we have a wonderful, wonderful show. We're going to be talking with a physical therapist out of the Charlotte area, Dr. Kristin Royen. Am I saying it correctly, Kristen? I probably am not. Did I say it right?
It's Royen.
Royen. Okay. So Dr.
Mhm.
Kristin Royen, she's a physical therapist. She is with Performance Rehabilitation Associates. They have 4 area locations in Charlotte, in the Charlotte area here. And Kristen has been a wonderful physical therapist to me and my family for quite some time now. And we wanted her to come on the show to talk about, being a physical therapist and how people would really need to understand all about, having a physical therapist in their life and the purpose of having one and the things, how it's going to help and benefit you in your life. So, with giving her introduction, I am going to let Kristen come in and tell us a little bit about herself and, why she chose physical therapy and what it can do for others.
Hello, this is Dr. Kristin Royen. I've been a physical therapist for 14 years. I went to East Carolina University, finished my doctorate in physical therapy in 2009. Currently working for Performance Rehab Associates in Charlotte. We're a combination physical therapy and chiropractic clinic, which is a unique but very beneficial combination of practices. Sometimes we will, co-treat patients between chiropractic and physical therapy when indicated, and it helps get better results. So it's been a really great place to work.
Nice, nice. So, Dr. Kristen, how did you decide physical therapy is kind of where you wanted to be?
I would say it was probably in high school. They tell you start thinking about your career choices, what you want to do. I found that my favorite thing to learn about was the human body. Anatomy and physiology class was the one that I really enjoyed. So I thought, okay, medical fields definitely need to be there. Let's explore that a little bit. And I really liked the rehab side of things, really helping people get back to leading the lives that they want to after injury, surgery, what have you. The nice thing about physical therapy is there's a lot more one-on-one time in this field versus if you're going to be just a regular medical doctor, visits are shorter. I don't think you get to know people quite as well. And yeah, just helping getting people back to live their life the way they want to.
Absolutely. So, with that being said, people getting back to live their life the way they want to. And you said sometimes there are injuries, and I'm guessing sometimes there's surgeries or there's different types of like I guess if a person have a stroke or something like that. So there are a lot of different reasons why people really, start to focus on the fact that they need to have a physical therapist involved, right?
Absolutely. And yeah, like we talked about, it could be a surgery or an injury, but definitely strokes, traumatic brain injuries, even just general deconditioning. If an elderly person has pneumonia that puts them into the hospital for several weeks, there's a lot of weakness and stiffness and lack of mobility that can result from that. So that's just a couple more examples of people that could benefit from physical therapy.
Okay, that's awesome to hear. I think when we think about physical therapy and I guess with like sports, a lot of people think that there definitely have to be an injury. But what I've learned or what I've seen is that sometimes when they're just, spots that you quote unquote can't stretch out or can't get to or it's it's weaker than other areas or should be stronger, then that's another way physical therapy come into play also, right?
Absolutely. I would say what I see at our practice, traumatic injury, even as simple as an ankle sprain, that's really not the number one thing. It's
Mhm.
more often chronic conditions, people having low back pain, neck pain, shoulder
Mhm.
pain, things that develop over time from either
Mhm.
having to work at a desk all day, or maybe a particular exercise that they like to do, and just slowly but surely pains will set in from different things. So we definitely treat a lot of that type of thing too.
Okay, okay, sounds good. So that is something definitely that I guess when we're thinking about our overall health, physical therapy is one of those things that come into play, though, right?
Yes, definitely. Because there are a lot of conditions that can be corrected, or
Mhm.
at least vastly improved upon with physical therapy.
Mm.
It's a great option to going on chronic pain medication. With
Mm.
some conditions, it could even eliminate the need for surgery. I always say surgery is the last option. Definitely for anything, any kind of physical
Mhm.
issue. It's worth being evaluated by a physical therapist to see what you can do conservatively, to not have to go under the knife, and to not have to take pain medications or something long term like that.
Okay, yeah, I love to hear that because that gives people a different alternative. I love that. That makes so much sense. With that,
Yes.
Dr. Kristen, we're gonna go ahead and go to a commercial break, but we'll be back in a few minutes and we'll talk some more with Dr. Kristen, our physical therapist. And we're back with We Got Options with the doctor and son. And today we are talking with Dr. Kristen, our physical therapist, giving us some good information about the field and kind of what goes on and who can benefit from physical therapy. So I wanted to jump back in and talk about the educational background of becoming a physical therapist. I think that's a big question that people have, and people don't really know how much education it takes to get there. So, Dr. Kristen, can you give us some pointers and give us an idea of what people can expect?
Yes. So you have to first get a bachelor's in something, somewhat related to the field. So I got my bachelor's in biology. A lot of people will do a bachelor's in exercise science, or exercise physiology. You could come from a bachelor's in psychology even. You just have to
Hmm.
meet the prerequisites to apply to grad school. So, physical therapy is now a doctorate program, which is 3 years at a university. You have to have, a good GPA to get in, good GRE scores, and a lot of kind of volunteer or shadowing experience to, kind of show the school you know what the field is about, and you know what you're getting yourself into.
Okay. So a lot of that is kind of like, I guess, considered maybe your clinicals or whatever they call them, like your clinicals or your internship type work for the most part.
Yeah, for applying to the school,
Hmm.
yes, they would consider it more of like volunteer shadowing. It's not so much an internship at that point, or it's not necessarily termed that. Once you're into school, that's when you go into clinical rotations.
Okay.
So different schools break it up differently, but there's X amount of like weeks or hours that must be spent in the clinical setting. So you will work in either a hospital or an outpatient clinic, or rehab facility directly under a physical therapist who's your clinical instructor. So you'll spend, either it could be 6 weeks, 8 weeks, 10 weeks. I think some schools will do maybe even like 4 month stints, as part of your within your 3 year program. And part of what helped become or help programs become doctorate level, was that they have a larger research requirement during the program than they used to when it was just a master's, or many years ago when it was just a bachelor's degree. So
Mhm.
all physical therapy students have to complete, or participate in a research project during their time, and write a scientific journal article as part of
Mhm.
the graduation requirements.
Okay, okay. So if I'm hearing you correctly, then there's the bachelor's degree, and then you skip the master's, or the program next is a doctor, kind of like a master's into a doctoral because it's 3 years, or you just kind of go from bachelor's to the physical therapy doctoral program.
Yes, you pretty much go directly into the doctorate program. So
Oh,
at
nice.
this point, there's no longer a master's program. I'm pretty sure all universities across the country have progressed their program to be a doctorate. So you can't get a master's in physical therapy anymore. You go straight into the doctorate program.
Wow. So that means when they started doing that, and I'm guessing they probably had to grandfather some people or do some stuff for some other people had to maybe go back to school that were like physical therapists prior, or did they have like how did they kind of bridge the gap? Did those people just drop to a different status? You know what I mean?
Um, yeah, yeah. So yes, anybody who got a master's or a bachelor's was pretty much just grandfathered in a way.
Mm,
But you then have the option to do what's called a transitional DPT
hmm.
degree. So say you had a master's, but you wanted to get that doctorate title, you could go back to school for an abbreviated amount of time, basically to cover any classes or any like research that would bring your current level of education up to the doctorate status. I don't believe it was made a requirement by the national board to do that, but you had that option.
Oh, that's awesome. It definitely makes it sound um more appetizing that you would, go from your bachelor's degree and then you fill out for this doctoral program in, physical therapy, and then you go directly into a doctorate program and then gain all that education. I love that idea personally. I wish I had it in my field, but
Yeah, yeah. So you kind of, I guess, skip a step in a way.
Mhm.
But yeah, I mean, it was great to just be able to get right into it and kind of,
Yeah.
go to the highest level that you can in the field, as far as education goes.
I love that. I love that. And it's a lot of hands-on. That's the one thing I like about physical therapy. There's a lot of hands-on experience, right?
Absolutely. I mean, the during the program, you're hands-on with the coursework, the lab work, your clinical rotations, you're directly with patient care. I mean, you can learn so much, with the books in the classroom setting, but I mean, it's very hands-on. Like you have to touch people, you have to get in there, get your hands
Mhm.
dirty.
Oh yeah. Oh yeah. I like that. Definitely. I tell people all the time, I'm a person that physical touch is one of my how I kind of respond. Like I hug people all the time when I meet them and stuff. So
Uh-huh.
so that is one of those things. I love the fact that you have, that type of contact with people. So yes, having
Yeah.
having a physical therapist it sounds like definitely the way to go to keep yourself healthy nowadays also. Yeah.
Absolutely. Absolutely.
All right, so we're going to run into a commercial break, and we're going to take a break and come back in a few minutes. And we're back with We Got Options with the Doctor and Son. Today, we are still talking with Dr. Kristin. She is our physical therapist, and I wanted to give her a chance to be able to let everyone know how to make contact with her if they feel their need for physical therapy, or even if they feel like they need to talk about it and see if it's, there are things that a physical therapist could actually help them with. So, Dr. Kristin, do you mind sharing some of your information of how people can make contact with you?
Not at all. So we have a very comprehensive website to check out. It's www.pracharlotte.com. On there, you can send us messages. We have details about all the different kind of treatment that we offer for various issues. Talk about some of the special tools that we have that we can use for treatment. You can also directly email at admin, at pracharlotte.com. Then our front desk will be able to get back with you, answer questions. If you wanted to get in touch with me directly, you can always just say, this message is for Dr. Kristen, and they will forward that to me. We also have an Instagram page that highlights a lot of the things that we do around the clinic. You can see what the clinic looks like. There's also different tips on, exercises for things like back pain or, back stiffness, improving balance, all kinds of things like that. So the Instagram handle is Performance Rehab Associates. One word, no spaces. It's just that.
All right. Thank you so much for giving us that information, Dr. Kristen. One thing I want to kind of talk to you before we leave today is just really talking about how physical therapy, how you guys have been able to use social media and kind of the new age of things. How are you guys starting to kind of implement that where you're really reaching the masses and you're really educating people and helping people understand, like, what are you guys doing as far as getting the word out there that physical therapy is something that could be very helpful, and just educating people. How are you guys kind of, getting it out there and telling people what to expect?
Gotcha. Well, as far as the digital world goes, we've got the website, we have the Instagram, and then we have a Facebook page as well. And Instagram and Facebook are so popular. It's easy for people to follow us, learn about us, share to their friends and their family. Um, Outside of the digital world, we also do pop-ups in different places. So a lot of times we'll go to, say, like a fitness studio on like a Saturday, and kind of collaborate with them. Like, they'll have one of their workout classes, and then, we would be around for like the cool down at the end. Sometimes do little mini complimentary treatments, soft tissue work, or if there's
Mm,
a chiropractor there, they will sometimes, offer kind of free manipulations and all that.
mhm.
So being out there in the community, I think, is, just as important as the social media part. But social
Mhm.
media is huge. We can't deny that's a big source of how we
Oh
get
yeah.
our name out there.
Oh yeah, absolutely. And you guys do a lot of education, like giving people little snippets of little this, that, and what's good for you and what could help with this, that, or the other, all that good stuff.
Yes, definitely check out the Instagram page,
Mhm,
because there will be little clips on, here are 3 exercises for improving upper back mobility.
mhm,
Or here's an example of exercises to work on balance, or here's one for, decompressing your lumbar spine to try to kind of open up and elongate your back.
mhm.
We also now use this really nice software called PT Wired to send people their exercise programs. So it's an app that the patient will download, and then, any exercises that we go over in the clinic and teach you will be uploaded to this app, so you can go in and view it. There's a video of the exercise. It will tell you, how many sets and reps to do, so you can, keep track of everything yourself. And some people like the accountability as well, because you can check off that you did your exercises for that day. So that's been a really nice addition to how we do things.
Okay, good. That's really something that's big nowadays because, again, like we said, as we are entering into this digital world, a lot of people, they like the fact that they can do stuff on their own and have like a visual, and not have to go into the office every single time, but still making their appointments, but then have something to follow up with, between appointments, like the weeks between or whatever the case, the days between. So yes, that's awesome. I love the fact that you guys have that app. That app is major for, well, with some people they can remember everything, such as myself. I can remember a lot of my exercises and get them done. But I think with the younger generation, a lot of individuals are trying to figure out, what, they can do. And if they end up missing an appointment, that they still can keep up and make sure that they're still doing their exercises on a daily basis. Because the world is
Yeah.
moving really fast now. So
Yeah, exactly. And people don't always like to keep up with paper anymore.
oh,
So this eliminates the need for like a stack of papers that, gets lost in your house. You're like, oh, where's my exercise program? It was in this room. It's not here anymore. So this way, it's always online. It's on your phone or your computer, and you can always go back and reference it.
Absolutely. All right. So again, Dr. Kristen, we're so happy that you came on and you were willing to do the show with us today. What we want to get now is just your contact information once again for the world to be able to hear, where they can make contact with Dr. Kristen and get these great services in physical therapy.
Yes. Our website is great resource. That again is www.pracharlotte.com. Phone number 980-819-8020. Through the website, you can send us messages with any kind of questions you might have. You can email us at admin or admin at pracharlotte.com. And we also have a really great Instagram page. The handle for that is Performance Rehab Associates. Just one word, no spaces. So definitely check us out on there too. Again, we've got some cool videos with different exercises for whatever you might have going on. You can kind of get a peek inside what the clinic looks like and the type of things that we do.
Awesome, awesome. Well, again, thank you so much, Dr. Kristen. We sure appreciate you coming on and being with us.
Absolutely. Thank you so much for having me.
Absolutely. And so that's a wrap. We got options with the doctor and son. We'll be back next week. Make sure you definitely jump on and listen to us Friday mornings at 8:30 a.m. This message is brought to you by Green McElwain Foundation. The Green McElwain Foundation organization is having a high tea charitable society event on June 24th, July 22nd, and August 26th. If you are interested in attending to mingle and network with like minded people, you can contact www.greenmcilwainfoundation.org, or you can send an email to lsmcilwain@gmail.com. That is LSMCILWAINE at gmail.com for further information.